Hello, welcome to today's Go Erie Facebook Live event sponsored by Gannon University. Today's event features Erie Times News reporters David Bruce and Jim Martin. They will be discussing the UPMC-Highmark consent decrees and how they affect patients in Erie and Crawford counties.
David, a lot of ground to cover today. Let's kind of start with the basics. What are these consent decrees?
The consent decrees are basically exit agreements between UPMC and Highmark that were brokered by the state. In 2014, they created a 5-year consent decree where folks with Highmark Blue Cross Blue Shield health insurance still had access to UPMC-Hammett in-network, which means at a lower rate, and other rural hospitals in western Pennsylvania up through June 30th, 2019. That is when these consent decrees are set to expire. The consent decrees came about because back in 2011, UPMC and Highmark were negotiating on a new provider contract where UPMC Health System would accept Highmark as an insurance. There were breakdowns in the negotiation. Highmark then purchased UPMC's main rival in Pittsburgh, the West Penn Allegheny Health System, and became an owner of hospitals. They later added St. Vincent Hospital and some other hospitals in western Pennsylvania. As a result, negotiations broke down and necessitated the consent decrees. They are exit agreements. As of June 30th, 2019, unless something happens, and we'll get into the Attorney General's petition that has been filed, folks with Highmark health insurance will not have access in-network to almost all UPMC hospitals, including Hammett, and folks with UPMC health plan insurance will not have access to St. Vincent or any of the other hospitals in the Allegheny Health Network. So
where do things stand right now?
So right now, the consent decrees are slated to end June 30th. In early February, the Pennsylvania Attorney General, Josh Shapiro, filed a petition in Commonwealth Court. What he's seeking to do is to modify the consent decrees, basically make them non-ending, that they will continue to have access. If you have Highmark health insurance, you will continue to have in-network access to UPMC hospitals. If you have UPMC health plan insurance, you'll continue to have access to St. Vincent and the other hospitals in the Allegheny Health Network that Highmark owns.
Okay. So what's next for people?
Well, what happens right now, it's kind of, things are up in the air. Folks don't know, we don't know if the Attorney General is going to be successful in getting Commonwealth Court to agree to his petition. A trial date is set for May 29th on one of the counts of the petition. If successful, and if it happens before June 30th, the consent decree continues past the deadline. But we don't know what's going to happen. That court case is months from starting. There have been rumors, nothing substantiated, that the Attorney General might file an injunction trying to seek a court to delay the end of the consent decrees. But no one has confirmed that. Those are just some rumors that are going around. We have not gotten any confirmation on that whatsoever. So folks right now are in a bit of limbo. Many people up here in Erie have already started switching their doctors. On Tuesday night, I went to Highmark's in St. Vincent's Meet Dr. Wright event, where they have doctors and other health providers from the Allegheny Health Network at the Bayfront Convention Center there to meet with patients and to say, hey, yeah, you've got Highmark health insurance, you've been seeing a UPMC doc, I can take you on as a patient, let's talk a little bit about the practice, what are your needs, things like that. The folks at Highmark told me that they have had 2,500 people make appointments with St. Vincent providers through these Meet Dr. Wright events, which is quite a big number. So folks are switching their doctors right now.
You kind of got ahead of my next question. Does that give you a sense of how many people are on the wrong side of coverage right now?
Just the 2,500. So we know there's 2,500.
Right.
There's probably many more, just based on how many folks have Highmark health insurance.
Because that's one provider telling you
It's one provider. I mean, these folks, if you have Highmark health insurance and you see a Hammett doctor, you don't necessarily have to transfer to a St. Vincent doctor up here in Erie. You can transfer to a Lecom Health doctor. You can transfer to one of the ones who are still independent. There's not a lot of them out there in Erie County and Crawford County, but there are some. You can transfer to them as long as they accept your insurance, and you'd have to call that particular office if they're an independent provider and find out, make sure that they accept your insurance. So I don't have a hard number. I reached out to UPMC earlier this week, and I reached out to Highmark, and I was not able to get a total count on how many folks are involved in this. But it's safe to say that it is thousands of people. If it's 2,500 appointments, you have to figure there are thousands of Erie and Crawford County residents who have to switch their doctors if the consent decrees end as scheduled on June 30th.
You say have to switch your doctors. What if I want to keep going to an out-of-network doctor or hospital?
It gets pretty tricky. Again, you don't have in-network access. These are out-of-net, so you would then be out-of-network. Obviously, if you have, let's backtrack just a little bit, and this was a question I had earlier today. What happens if you're an emergency case? You get in a car accident up here in Erie, and you have Highmark health insurance, and you are taken to Hammett. You're covered. That's emergency care. You are still covered even if you have Highmark health insurance for emergency care. Once the emergency has been treated and you are no longer an emergency patient, you will be transferred if you have Highmark health insurance, either to Vincent or to West Penn Allegheny down in Pittsburgh or somewhere else where they accept your insurance. But as long as you're an emergency patient, you will be covered in network at a hospital, at Hammett or at any other UPMC hospital. Otherwise, you will not be, if you're trying to get an elective surgery or you're trying to see a doctor, they will probably tell you when you try to schedule the appointment that you're not an in-network patient, you would have to pay out of pocket. UPMC is saying that once the consent decree ends, they will accept these patients, but they will not only require them, they will be out of network, they want the fee up front. They will want the patient to pay up front for their office visit, for their procedure, and then they will give them the paperwork in order for the person to collect whatever would be covered from their insurer. So you not only would have to pay for the out-of-network cost, which is more than an in-network cost, you would have to pay the entire bill up front and then seek payment from your insurer.
And I guess it goes without saying, in a lot of cases, that's going to be prohibitive.
It's significant. It could range, and again, these are guessed. I mean, a typical doctor visit, the out-of-pocket cost, somewhere between $100 and $200, and a procedure, we're talking, thousands to tens of thousands to perhaps even more for a very extensive surgery.
I know you get a lot of calls and you're in contact with a lot of people on these things. Do you hear a high level of frustration from people over what's happening?
The calls I get, the people are frustrated. I had a call earlier today from an older lady who just says, why can't Hammett just get rid of UPMC? Well, it's certainly not that simple. I mean, Hammett was seeking a partner years ago when they joined UPMC's network. And then Vincent sought a partner when Highmark created Allegheny Health Network. There is a need for this. Hospitals, every hospital in northwestern Pennsylvania, or at least in Erie and Crawford County, every single hospital has joined up with other hospitals. Whether bigger hospital systems like Hammett and Vincent joined up with bigger hospital systems, or smaller ones. Mill Creek Community Hospital joined with Corey Memorial. They joined Lecom Health, which is the parent organization. Titusville Area Hospital joined with Meadville. So we've seen this with every hospital in the area. This is the way of the world.
Okay. Talk to me about this case in Alabama. What's going on with UPMC in this antitrust case?
Sure. There's been a couple developments. The Pittsburgh Post-Gazette reported on this the other day. So since the Attorney General filed his petition, UPMC has filed several courts. One in Alabama, they have joined an antitrust case, which I believe has been going on for about 6 or 7 years. And this is kind of interesting. So Blue Cross Blue Shield is a series of health plans that are all under Blue Cross Blue Shield. In Western Pennsylvania, it is Highmark. But there are other Blue Cross Blue Shield plans, and they each have a territory in the United States. For example, I believe the one for the Buffalo area is Blue Cross Blue Shield of Western New York. I think they might have a new name, but I think that's what their traditional name was. Over in Rochester, it's Exelis Blue Cross Blue Shield. What UPMC wants to do is they want a court to decide that it is no longer, Blue Cross Blue Shield has rules and regulations that, let's say Exelis Blue Cross Blue Shield, cannot negotiate with UPMC to have a provider's agreement because there are no UPMC hospitals in the Rochester area, in their designated area, even though they might insure folks in this area. They don't have a hospital in this area. UPMC doesn't have a hospital in Exelis's area, So they're not allowed by Blue Cross Blue Shield, the national organization, to have any negotiations with UPMC. Through this lawsuit in Alabama, which UPMC has joined, UPMC wants that rule to be struck down. They want to have the right to be able to negotiate with any Blue Cross Blue Shield plan. So they don't want to negotiate, they would want to not negotiate with Highmark, but negotiate with other Blue Cross Blue Shield plans, which they feel would increase competition and actually have Blue Cross Blue Shield plans from different areas compete and perhaps bring the cost down.
Any sense about how quickly that case is moving to resolution?
Not really. I mean, it's been brewing for a while. I would think there's something that might be going on in the near future, but it's speculation on my part. There is another UPMC. I'm going to put my glasses on for a second. UPMC has also filed a lawsuit. This was a couple weeks ago. More in line with what the Attorney General did. They filed a lawsuit that seeks to stop the Attorney General from interfering in the consent decrees. So that's also being processed through the legal system. So there's been a lot of activity. Like I said, we're going to see what happens on the Attorney General's side as far as if they're going to file an injunction. Otherwise, unless something unexpected comes up, the next big date is either when something happens on the UPMC side, where there's been a ruling on one of the UPMC lawsuits, or when the court case begins in Harrisburg on May 29th on the first count of the Attorney General's petition. Gets a bit complicated.
Let's drill down on Attorney General Josh Shapiro's case a little bit. Mm-hmm. Let's try and understand what that's all about and what happens. What are the potential results if you're winning that case or not winning that case? What are the potential outcomes there? And kind of help us understand the crux of what he's really after.
Well, what the Attorney General, and I was down there in Harrisburg in February when he made his announcement, what the Attorney General wants is for folks to have access to both hospital systems regardless of their insurance, to have insurers and health systems be able to negotiate without any hindrance on this. He wants continued access for Highmark folks at UPMC hospitals. He wants UPMC health plan folks to have access to the Allegheny Health System hospitals, including St. Vincent. If the courts rule in his favor, then the consent decrees would be modified to allow that. To any insurer who would want to contract with a health system would be able to. If they can't reach a deal, it would go to arbitration, and they would put forth their best deal, their best offers, and an arbitrator would pick one of them. That's part of the modifications that the Attorney General wants as part of his petition. So it would basically make it an open system. It would continue the consent decree past the June 30th deadline. If it fails, then the consent decree takes effect July 1st, and like I said earlier, if you have Highmark health insurance, you will not have in-network access to almost all UPMC hospitals. There's a few, including Children's Hospital and a couple others. If you have UPMC health plan insurance, you won't have in-network access to St. Vincent and the other Allegheny Health Network hospitals.
Now here's a point of confusion, I think, for some people, including me. Correct me if I'm wrong here, but Allegheny Health Network, St. Vincent locally, has already agreed to the terms of this,
yes,
correct?
They agreed they reached a deal with the Attorney General, UPMC did not.
Does that mean that even if UPMC continues to say no, that you can get access to can this be one-sided?
So what you're asking is, let's say the court rejects the Attorney General's petition.
Yes.
But they have a deal with Highmark.
I'm glad you understand what I'm asking.
Now that I've repeated your question, I don't know. I don't know if I would think that it would go. It's a good question to ask. I will ask, but my gut feeling is that no, after the consent decree ends, that it would still be no access, because I don't think I'm not going to speak for what I think they think. I believe that it's going to go if the courts rule against the Attorney General's petition. I believe the consent decree ends, and it's as it's been expected for the last 5 years. But I don't know, and I'm going to ask.
And just one other thing, what's the basis of, as you understand it, of the Attorney General's, what's the case he's making here? It's not just to say, well, this is the way it should be.
No.
What's he basing that on? Why
He's-
is he saying this should be the case?
He was very strongly worded in his press conference 2 months or a month and a half ago. As a charitable organization that gets tax exempt status on its properties throughout Western Pennsylvania, the UPMC has a duty. This is the Attorney General's words, to offer care to people regardless of their insurance, to be more open. Basically, they have a duty to the community to take care of people, whether they have UPMC health plan insurance, whether they have Highmark insurance, or regardless of that. UPMC, in a rebuttal to that, says they provide a tremendous amount, and I don't have the figure in front of me, but it's a huge figure of community care, whether it's treating uninjured or uninsured folks or what have you. They say they do follow that, but the Attorney General says they have a duty above that. That includes accepting patients with Highmark insurance.
You know, obviously, there's this case playing out in Alabama, but is this something that's happening across the United States, or is this a relatively unique situation what we're seeing here in Western Pennsylvania?
I hear a lot about Kaiser Permanente, and they have a closed network out west. They are a health system and an insurer, like UPMC and like Highmark is now. They have a closed system. I don't know, and I'm not saying there isn't, I don't know of another situation just like this. This is why this battle has gotten national attention. I wouldn't be surprised if there's another one that is similar to this, but in most places, what you have is you have 3 or 4 or 5 insurers, and many of them are national, and they are all kind of competing with each other. You didn't have this, what we used to have. We had Highmark dominating the market for private health insurance, and now you have UPMC, and just in the last year or two, because of the consent decree, you're starting to see increases in the national insurers, which are my national health insurers, I mean Aetna and Cigna, US Healthcare, and those ones. You're starting to see them get a little bit more business because, unlike Highmark and UPMC Health Plan, after June 30th, regardless of how the consent decree, they will have access to both. Now, there are downsides to this. I don't know how aggressively Aetna and Cigna and these other ones go after small and medium-sized businesses in Erie County. The history was they didn't. They just wanted the larger employers. And secondly, not every physician, especially independents, has provider contracts with some of these national groups, where they are more likely to with Highmark and UPMC Health Plan.
Right. David, obviously a lot at stake for a lot of people. Anything else here that we should be talking about that we've not covered?
Well, let's talk a little bit about the patient aspect of this. I mean, the reason this is such a big story is because it affects so many people. And it's such complex situations, like what I found Thursday night. And so I went to the Meet Dr. Wright event, and I ran into a school nurse from the Erie School District. And she told her story, and it was in the paper. She was under the impression, and then I was, because I was talking with her, that no matter what, she was going to have Highmark health insurance for the whole year, and that she needed to switch her doctor. I find out the next day that the school district, and this is a tricky situation for them, they are negotiating with their teachers association on a new contract. Their insurance, most folks' insurance, renews on January 1st. They have a calendar year, but not everybody. The Erie School District, and this makes sense because it's kind of based on a school year, their insurance kicks in July 1st every year, which is the same date that the consent decree, it's the day after the consent decree expires, of course, unless the Attorney General's petition is approved. So while the school district and its teachers union are negotiating overall on a contract, they've also taken bids on insurance, which is part of the negotiations, and they've got to take this all into consideration. So they have a bid from Highmark, a bid from UPMC Health Plan, a bid from Aetna, and then they have bids from Highmark and UPMC Health Plan to offer side-by-side plans, which is what has been offered to a lot of businesses in Erie County in the last year or two, where each employee then can pick whether they want Highmark or UPMC Health Plan for them and their family. That's what the school district is doing right now. They're trying to negotiate what plan, what the union, what the teachers and the other staff are going to pay for the plan, all with the consent decree hanging over their heads. So it really is a complex situation. And this is just one organization of about 1,350 people. This has gone on all across Erie and Crawford counties. people in businesses, what insurance do they have? How does it affect them? What doctors are they going to have? It's been personal decisions for thousands of folks in Erie and Crawford counties.
No, maybe I'm wrong, but I would just sort of assume that those side-by-side opportunities, which seem ideal, really, are probably just offered to the larger employers. Is that
They
fair
were
guess?
in the past. I mean, some organizations like GE and some others have had side-by-side plans, or they were able to choose plans for years. But it has increased in recent years. Highmark and UPMC Health Plan in very recent years, the last couple of years, have agreed to make this more available to some, at least medium-sized companies. And it's a great offer. Now, keep in mind, though, let's say you have a family, and you're the employee, and you're the one responsible for the health insurance through your employer, and let's say you see a Highmark doc, your spouse sees a Hammett doc, and your kids are they see, or you might see a Highmark or a St. Vincent
You
PCP.
still have to choose.
You still have to choose one of the two. You're still deciding for your whole family. Every doc you see is going to either be Vincent-based or Hammett-based or Lecom Health-based or independent. But you still have to make decisions even with the side-by-side plans. But at least every employee then has a decision for his or her family.
Right.
It's complex. As we've said in the newsroom, it has a lot of tentacles, and it affects a lot of people in Erie and Crawford counties, and which is why it's such a big deal.
Okay. Anything else we should be hitting on today, or is that?
No, we'll keep folks updated. If we find out anything about an injunction, we will report that. Otherwise, any updates on this, we will certainly be keeping folks notified through the Erie Times News and on goerie.com.
One of our viewers did ask a question, if you have time to answer it here. Why does it matter who pays the hospital? UPMC, must they be gaining something that they're not willing to accept the Highmark insurance?
What UPMC has said over the years is they said when Highmark purchased the hospitals that became the Allegheny Health Network, they said, certainly we support that, but they are now competitors with us. We are both health systems that have insurance companies, and we are going to compete against them, and that it makes more sense if they're not going to then basically fund their competitor. They also, right after the Attorney General's decision, one of their spokespeople said to me, he said, this consent decree is helping not lower costs, but reduce the increases in healthcare costs. This is, UPMC claims, the right thing to do for the long-term costs of healthcare. They think, what they have said is that this saves people money having these two separate systems and keeping everything in its own silo. So that's what UPMC folks have said over the years on this.
David, thank you. Jim, thank you. And I'd like to thank our viewers for watching and participating in the Go Erie Facebook Live event. The event was brought to you by Gannon University.